Hi everyone, it's me, Arielle, and it's Wednesday Warriors, and this week I'm going to be talking about bipolar disorder and eating disorders. We're continuing our weekly tradition of talking about comorbidity with eating disorders, and we've gone through a number of different conditions at this point. And this week I'm going to be touching on bipolar disorder because besides the fact that many people who struggle with bipolar disorder also struggle with eating disorders and vice versa. There are similar characteristics between bipolar disorder and eating disorders. A similar characteristic between the two is impulsivity. And what I mean by impulsivity is impulses. Impulsive behavior that's characteristic of certain eating disorders is also a characteristic of bipolar disorder. I think it's very important to remember, though, that bipolar disorder, certainly though it's characterized by ups and downs, it can be treated with medication. And I know a lot of people are very hesitant about being on medication. They feel that it's a weakness, or they feel that they'll be less themselves. And I think that those are really valid points and really valid fears and concerns. But bipolar disorder can be treated. It can't be cured, but it can be treated. And sometimes it takes a while to find the right medication or the right combination of medications to treat bipolar disorder. But one of the benefits of certain medications to treat bipolar disorder is that it helps with the impulses. And depending upon your eating disorder and your eating disorder characteristics, the medication you're prescribed for bipolar disorder can also in turn help some of the symptoms of your eating disorder, help to control certain things to a point where you can regain control of yourself and your life. One thing I really want to talk about in this video is stigma, because I think, at least in my life, the things that I hear and see, so many people use the term bipolar in the same way people might use the word retarded when they really mean to say something else, and they're sort of using like a politically incorrect term. You know, if they want to say something is silly or stupid, they call it retarded, and they don't really take into consideration the meanings of that word and what that might mean for some people, or it's in bad taste, I guess. I'm not really sure how to explain it any better than that. And I know that mentally challenged, or there are certain terms and classifications that are used instead of the word retarded these days. But I do think people are very flippant in using that word, and it always kind of makes me jump back. And I'm not saying that to judge people that may have used that word, but it does sort of make you stop and think and realize what you're saying, and it does sort of stigmatize someone who does have mental challenges. So along the same lines, I hear the word bipolar being thrown out by people, in just normal speak, in everyday conversation. And they don't mean that someone is actually diagnosed with a bipolar disorder when they're using it. They're saying like, oh, someone's acting bipolar, or you're so crazy, you sound bipolar. They're using a term of mental health status, and I think it can be very discriminatory, and I think it's just very stigmatizing. People don't mean to do this. At least most of the time, I don't think they mean to do this. It's sort of a learned behavior, a learned conversational mechanism, and usually people just don't even think about what they're saying, so there's no ill intent. But I do think because of this, and because of other things in our society, people who are diagnosed with a bipolar disorder feel kind of ashamed of their diagnosis. Now, I'm generally speaking, I don't mean to say that everyone who's bipolar is ashamed of their diagnosis, but I do think it usually takes a certain amount of time to understand it and come to terms with it and be okay with it, because it sort of has a negative connotation in our society. I think if you tell someone that you're bipolar, I think a lot of people find you more incompetent or crazy or less than a normal person. And I think that people who are diagnosed with bipolar disorder are incredibly normal and have every capability to live a normal life, whatever that might be. I also think that when you hear news stories about people who've committed crimes or done some kind of atrocity, that they talk about if that person had a mental health diagnosis, and sometimes that person is bipolar, and oh my gosh, that's the reason why they killed this person or raped this person or had this reaction to this or that. And I think that's very unfair and, again, very stigmatizing, because what I would challenge you to do, if you know someone who is bipolar, or if you're bipolar yourself, Google famous people who are bipolar. And I think it's pretty cool to realize different celebrities, different authors, different big names in technology or society or politicians who have the diagnosis of bipolar disorder. And it can, one, be comforting, make you feel a little bit better, and two, let you see that really people who have a diagnosis of being bipolar are not all crazy people doing crazy things in society. It's simply a, I don't want to say media scheme, but certainly the media does warp things in a certain direction to really stigmatize mental health issues. Bipolar disorder is also known as manic depressive disorder. That used to be the common terminology. It's very almost universally called bipolar disorder or bipolar affective disorder these days. There are all different kinds of bipolar disorders. There's bipolar disorder with depressive episode, with manic episode, with both, hypomanic episode, mixed affective episode. Everyone who is diagnosed as bipolar is an individual and has individual features, and it involves chemical imbalances and things with the brain, and it's not something that they choose. People don't choose to have a mental illness, and people certainly don't choose to be bipolar. It's something that is happening with their physiology, and they can't help it, plain and simple. Bipolar 1 disorder is one or more manic episodes, and there are subcategories, some of what I've already talked about, but it's one of the main kinds of bipolar disorder. There's also bipolar 2 disorder. That's typically not characterized by any manic episodes, but one or more hypomanic episodes and one or more major depressive episodes. So you can't even characterize bipolar disorder as one type of thing. There's bipolar 1, there's bipolar 2. Again, everyone's an individual. Every mental health diagnosis and issue is different because everyone is an individual. And it's really important not to stigmatize people, not to stigmatize yourself, not to think that you're any less of a person. And certainly, again, if you're dealing with a mental health diagnosis like bipolar disorder, and then you're also dealing with an eating disorder, it's a lot to handle. And it can be very challenging to treat both separately and treat both together. Certainly there will be links. Certain characteristics of both that are in common, like impulsivity, can be very important to recognize when trying to treat the symptoms so that life can be as normal as possible. So I think more than anything, when you're dealing with a bipolar diagnosis and an eating disorder diagnosis, that you're self-aware. Self-awareness can really go a long way. A lot of it is about mood stabilization, and mood stabilization is important in treating bipolar disorders. So if you think about the way an eating disorder manifests itself, you essentially, because you're not fueling your body properly or you're doing things to hurt your body like binging or purging, you are affecting your mood, you're altering your mood. A lot of the time, you become depressed as a symptom of your eating disorder. You have very low lows, and your mood is certainly affected by the kinds of things you take into your body or the kind of things that you deprive yourself of. So If you're trying to treat a bipolar diagnosis, but you're full-fledged using your eating disorder as a way to cope or just as something else that you're struggling with, it can be really, really challenging to stabilize mood. Mood can be affected by so many things, food included, starvation included, binging and purging cycles included. Another thing to be aware of is suicidal tendencies. I'm not in any way, shape, or form saying that people who are bipolar are suicidal, but depending upon how well they're being treated or if they are not being treated, suicide can be an issue. And certainly when you throw an eating disorder into the mix, suicide can be even more of an issue. So it's very important to have people that you can reach out to, people who can support you, even if it's only one person. One person can go a long way. It's much more about the quality of support than the quantity of support. And just again, be very self-aware and have a plan in action if you become very depressed or are having a depressive episode, that you do have someone you can go to or call, even if you're not able to get out of bed or leave your house or do the everyday things that you need to be doing, that there's someone that you can reach out to that can help you and help you make that step forward and give you that push so that you can start going in the right direction, whether that's by calling your doctor or a therapist. I'll post some links in the info box for you guys that I hope you'll find helpful, since I can certainly not fit everything of note into a short video. And I hope you're having a wonderful week out there. I'll see you next time.